I felt like my back was just all kind of thrown off, and I didn't have the core strength anymore. And I was just tight, and I couldn't, be like comfortably have good posture. And I was having some pain in my mid back.
Leg drop. So this side first. Shoulder. Oh my goodness. Hello Baltimore, it's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor, and I have Emily with us this morning. Emily, good morning.
Good morning.
Yeah, so tell people what brought you into the office originally.
Originally, I had sort of a litany of discomfort in my back. I have some mild scoliosis, and just with working in a computer all the time and having gone through like 2 pregnancies, and just I felt like my back was just all kind of thrown off, and I didn't have the core strength anymore. And I was just tight, and I couldn't, be like comfortably have good posture. And I was having some pain in my mid back.
Neck pain, mid back pain.
Yeah.
Something around a rib somewhere.
Yeah, we did some dry needling this morning.
And some low back pain. Is that bothering you too?
Low back is probably the least of my issues, but I have had that before. Yeah.
How many children?
I have 2 kids.
2 children.
Yeah.
When did all this start? How long ago?
Well, I found out I had scoliosis when I was 28, so that was 10 years ago.
Really?
Yeah.
Wow, someone missed something along the
I
way.
know.
Where's that grade school nurse, right?
I don't know.
But you had seen other chiropractors before, right?
I did see another chiropractor, but the approach was different.
How long ago did you see them?
It was before COVID, so.
Before COVID?
Yeah.
Okay.
It had been, I guess, over a year.
And how many times had you gone to that particular chiropractor?
Like maybe a dozen. I started seeing her for foot pain. Like after my pregnancy, I just had a lot of foot pain.
Right.
I guess my bones just kind of like going back. And she helped me with that, and then I just was like doing some maintenance visits with her. But then I had new issues that happened during COVID.
Why didn't you go back to her versus coming here?
She was lovely, but I felt like I had a new and different set of problems, and I liked how here there's like a whole gym with the PT part incorporated and like the dry needling, that I just felt like I needed more of those components, and it was all
you were getting before. Yeah, that's good. So the PT part is, I don't know if people know this, but in Maryland, chiropractors have a chiropractic degree, a doctor of chiropractic, with or without physical therapy privileges, if you will, right? So I don't like to call that, I mean, you have to call it. To me, physical therapy is passive physical therapy, where we're doing most of the work, and then there's active physical therapy or physical medicine. I like that terminology because it describes what we do more. And we really push people when they get out of pain to get more involved in more physical activity, right?
Yeah, like this is exercise.
Yes, it's all about mobility, creating stability, and then the next step is to get strength in those areas, right?
Right.
Because if you don't restore mobility and stability, it's hard to safely get stronger and more functional again, right?
Yeah.
Because eventually your body is, and I don't like this word alignment, but basically, when your body's not moving the right way and you keep pushing it, it's eventually going to break down, and that's what happens to people a lot. Yeah. So we've sort of, the upper back pain, the neck feel a little better.
Yeah.
Yeah. So we've got it isolated now into this
just one spot.
This rib where it attaches to your mid-thoracic spine. So today was the first day you were dry needled. Yeah. And did you exercise also?
I did. Yeah.
Yeah. So go ahead and stand up for us.
Okay.
Yep. So. Since you've been coming in, this is your 7th visit with us, so you've had 6 already. What would you say overall, have you improved all the areas except for the rib? What would be the percentage? 50, 60, 70, 80? Where would you be?
I'm 80% better. This one spot is still stuck, but I think we're going to work through it, yeah. But when I started coming in, I couldn't even sit comfortably. I just couldn't get comfortable even just sitting in a chair.
Yes.
And it only took like a couple of visits to feel better.
So
now I'm just like getting more mobility.
So now it's always stuck if you really take it to the extreme end, right?
Yeah.
Yeah, and she was showing us the positions
Like I have
where
to twist to feel it.
at the very end range of motion.
Right.
You know, Emily uses a great word, and we use this word around here all the time. And she didn't get it from us. This is how she described her symptoms. She said, I feel like it's stuck back there, right?
Yeah.
And so what chiropractors look for from a joint perspective and a soft tissue perspective is we look for areas that are stuck. Stuck is poor movement. So, you know, it's like Goldilocks and the Three Bears. The tissue this is joint tissue, has a great springy end feel to it, right? And then over here is something that's stuck or fixated, or it just doesn't want to move right, you know? And then on that side of the fence, way over there, is a car accident or a sports injury.
Yeah.
And there's been some tissue trauma where fibers have actually lost their integrity, so they're no longer like this. They frayed or they're torn to some degree.
Right.
You know, first, second, third degree strain, whatever that may be, right? And you live over here, which is where you want to live,
Right.
where you don't move very well. And you have that one component where you have a little bit of scoliosis. And does that influence it? Sure, because, you know, your body doesn't move in certain areas along those curves where you've got to maintain the mobility. If you maintain the mobility, you'll be fine. You won't have any problems.
Right.
Yeah.
Right.
So let's have you just go ahead and face Liam. I just want to see something. You stand right there. I want to get over here so I can see. So go ahead and bend your upper body, lean to your left side. Any discomfort at all when you do that?
No, I mean, I realize I could stretch my hip more. I feel tight, but no.
What side's your ribs stuck on?
It's the left.
Left side. Now go back to the other side. Yeah, how's that feel? Does that feel different?
I just feel like it doesn't hurt, but I don't feel like I can move. I don't know. Am I moving as far? I don't feel like I am.
We're going to look at it. That's why we're doing this, yeah. Yeah, now go back the other way for me. Yeah, back one more time to the left. Okay, good. Okay, now turn your head to the left for me. And turn your head to the right for me. Okay, so let's have you lie on your left side down, and you're going to face the mirror, okay? So I think she's still a little bit stuck on bending to the left. Bending to the right is gorgeous, and I'm going to take that first, okay? Liam, I'm going to cross in front of your field of vision. Excuse me. There you go, right there.
I'm learning.
And I'm going to untuck that right there for me. Emily, take a nice breath in for me and let it go. And let that leg drop. Beautiful. Other side for me. Nice job. So we're going to go like this. And then again, same thing. Nice breath in. Let it go. Drop that leg. Good. On your back for me. And straighten those legs out for me. And I'm going to give this leg, I'm going to adjust her hips a little bit, okay? And her hips really move very well. There you go. You feel that a little bit at the end. What does it feel like to you?
Felt it here.
Yeah, so here's what it feels like to me. It's a ball socket joint, and I just get a little tension right there, and I just releases for me and sets right back in.
Yeah.
Lift your head up for me. Thank you. And you can rest your head back down, and I want you to slide back towards me. So when I was watching her move her neck, I felt like she moves a little bit better going to this side first. Beautiful. And then let's go back this side. And drop this shoulder. There it goes. Beautiful. Okay. So let's bring you back up and see if that influenced anything. So let's have a stand right there, Emily. And Liam, go ahead and get back into that position over there. Let's see you bend to the right side for me, please. Yeah, see, that's really good. Go back to the left side. Yeah, it's got a little better. How's that feel? Does it feel any different? Yeah, turn your head to the right for me. Yeah, see, that just got better right there. Now go back. The left was always good to begin with. Okay. So we're going to, do I normally take you back to the corner of the office and put your hands over your head and do all that nonsense?
Yeah.
We're going to do that nonsense in here.
Okay.
So you'll sit right here for me, okay? And your legs are going to go up that way. And you look straight ahead. And I want you to scoot away from me a little bit. That's perfect right there.
I'm in the crack.
Yeah, your hands on top of your head. Up here in front of your bum.
Yeah.
Yeah. Elbows in. Drop your chin down for me. And I want you to come back to me. Right there. That's perfect right there. Now, hands stay there. Elbows open. You're going to take a nice deep breath in for me, honey. And let it go. Oh, my goodness. There we go. That was beautiful. Now go ahead and stand up.
Okay.
So I'm getting her mid-thoracic area. I'm taking that stuck area and I'm restoring some mobility to it. Yeah. So try to find that, you know, we were playing with this earlier before you all came in. Try to find, if you want to sit down, try to find and see if that stuck area releases a little better. I mean, we really, she was really, her motion was, yeah.
Yeah, it's loosening little by little.
Yeah.
I can still feel it, but like I couldn't do this before at all.
No, that's right.
So
what we did, we started at is with dry needling. We were trying to work along the intercostal and where that rib head attaches to your spine. We're trying to take the tension out of there.
Yeah.
Anything else you want to share with Baltimore, Emily?
So far, so good.
Yeah.
Highly recommend.
Yeah. Front desk great.
Yeah, they're great.
Was it easy to get an appointment?
Yes.
Yeah. Great.
I pretty much named the time.
You did?
Yeah.
Oh, don't share that with
I know.
me. Don't do that. Don't do that to us. Thank you, Baltimore.